This is so weird. I'm not really a fan of this. But anyways, I'm Bailey Howell, obviously, as most of you should know. And I really miss being in class for these speeches. We have a lot going on right now with, the pandemic and everybody getting sick. And I thought this was an important time to use my persuasive speech for kind of bringing more, insight to the possibility of universal health care. Because we think about, we're going to get sick, we're going to go to the doctors, we have to do all these things. But what about people that don't have health care? And that is where universal health care comes in. So I used this website called The Balance. And according to The Balance, 18 countries around the world have universal health care at this moment. And among those 18 is Australia, Germany, Sweden, the UK, New Zealand, and France, and Canada. I don't know if I mentioned that one. But those are all just some of the 18. And then we also have some countries that have no health care. So at least here we have private health care and we have things such as Medicaid, government-funded health care. But they don't cover everything, or sometimes they don't cover anything, and you end up with huge bills. So most of these countries that have universal health care still have a small prescription fee, in which, you go to your doctors, you're fine, you get your prescription, you have like $20 to $50 prescription fees, and you're good. Here, our price of insulin is constantly rising. People here will literally drive to Canada to get their prescriptions for way cheaper just across the border, which is not far from New York, but of course other states in this country, it's way too far. So that was on commonwealthfund.org if you want to go look at that. But I just thought that was kind of important to acknowledge the fact that a lot of other countries have it, it's running, it's working, and they're still getting the care that they need. So what universal healthcare does is it removes the competition. So it takes away all of the privately owned insurance companies. And those insurance companies have a tendency to target the wealthier population. So the wealthier population is able to pay doctors more for expensive services, which lead to more research, newer services with more expensive costs that the average person cannot afford. So it makes things unattainable for the majority of people, which is really crappy, and we shouldn't have that. It results in a for-profit system, which isn't good because it focuses on who can pay rather than caring about who can't pay. But some controversial things. What about how the healthy people and the wealthy people will end up paying for services that they don't need? Think about it like car insurance. You have a car, you have to pay insurance, right? And you pay insurance for like 3 years. You never get in an accident, so why are you paying insurance? Well, one day you get in an accident and it costs like $75,000. You have insurance. These things count. Everything that you've paid for the past 3 years on that car, that one accident, you're good. You're covered. You don't have huge out-of-pocket costs. You have a deductible, but you don't have crazy bills. And it actually creates, the universal healthcare system actually creates a lower price for the economy, like a lower economy cost. So then with that, the government officials are able to leverage the market size and negotiate the prices of things because the market size is so leveraged. So then that brings you to lower administration fees. In private healthcare, patient administration fees are on the patient. The patient ends up having to pay for all of these things. And administration fees are like, your doctor's office and the hospital and the ER and the anesthesiologist and your radiologist. All those separate doctors that you see, or all those separate services that you see in the one doctor's appointment, all give you separate administration fees. I don't know about any of you guys, but I've had so many surgeries, and every single one I've had a stack of bills from one surgery. So the universal, you get one bill, not many. And so my little like show and tell thing, is these bills. This is the ER bill for, or actually the operation bill, $1,300. The ER bill, the practitioner's bill, the ambulance bill for another $1,300, radiology bill, anesthesiology bill, all these, and they go on from one day, one surgery, in and out, hundreds and thousands of dollars, multiple bills, and it's overwhelming. With this, if we went to a Persuasive, oh my gosh, I'm trying to focus on making my speech persuasive. If we go to a universal healthcare system, you get one bill. It's not so overwhelming, and it's not as costly because what this is not administration fees, it is administration fees, but it's not just those. It's also all the co-pays, all the constant deductibles, everything, because I have private insurance through Cornell, and I still end up with hundreds and thousands of dollars from a dermatology appointment, a doctor's checkup, every little thing. And then we get to, what about wait times? So you're going to have wait times. Like, they're only weeks or months. Like, they're not that long. We have them here. I've been waiting for months for a hip replacement. Actually, years. And it's going to be the same. It's not going to change that much. ER appointments are right there. Like, you go to the ER, you're in, you're out, you're good. And you don't have to worry so much about it. You still get your basic doctor's appointments. You still get all the things you need. But things that aren't exactly medically necessary or emergency, you can wait on. And that's not a big deal. If you have to wait, in my opinion, if you have to wait for a medically non-necessary appointment so that somebody else who needs something can go and get it, it seems pretty beneficial. Like, I don't mind waiting, so I don't think that if you have good human morals, you should have to wait. But that's just my opinion. So then we get back to, people are going to oppose it. And a lot of people oppose the Affordable Care Act, the ACA. And prior to the ACA, 46% of Americans only use the ER because at the ER you can't be turned away. No matter what, whether you can afford it or not, you get care. And afterwards, people can go, now we have it, and people are being able to go get preventative care and proactive care, and they're taken care of. So that brings you to the children. Children are our future. And when children have a good health, like a good health care, a good support for their health, good health knowledge, they miss less school, they have a better foundation for success, and they're healthier overall. So that prevents future illnesses. And when you can prevent future illnesses for the future and growing population, then we end up having better generations and better success rates in students and children and just growth in general for our community. And I think that that is important. So for all of those reasons, I believe that we should switch to a universal healthcare system. There will be hard things to deal with. There will be different things to go with, but change is important sometimes. Thank you.